2,
3,
4,
5,
6,
7,
8,
9, 10.
Imagine living your day-to-day life constantly hearing voices inside your head, giving you commands on how to live. These voices control your relationship with other people, tell you that everyone is out to get you, and eventually you completely pull away from everyone that you are close to because you're so scared and paranoid that someone is planning to harm you. This abstract idea to you is the daily reality of people with schizophrenia. Schizophrenia is a life-controlling brain disorder that people have to deal with their entire life after symptoms have set in. This not only includes dealing with hallucinations, negative thoughts, and actions, but also dealing with doctor's appointments, diagnostic tests, medications, and therapies. Schizophrenia is a group of severe brain disorders that is a chronic condition that requires lifelong treatment. Schizophrenia means split mind. This refers to the unusual balance of emotions and thinking that individuals experience. People with schizophrenia interpret reality abnormally, with a combination of hallucinations, delusions, disordered thinking, and behavior. The exact cause of schizophrenia is unknown, but scientists believe that it is caused by several different factors. Brain cells communicate with each other with the use of neurotransmitters. Persons with schizophrenia have a complex imbalance of neurotransmitters. Also, structural differences in the brain are present. Fluid-filled cavities at the center of your brain are called ventricles. These ventricles are enlarged with people with schizophrenia, along with different areas of the brain having more or less activity than normal. There are many different aspects of a person's life that is affected by these changes. There are many different symptoms that are present with schizophrenia. The trademark symptom of a person with schizophrenia is hallucinations. The most common is auditory, which involves hearing voices that control and dictate the way a person lives. Another hallucination involves seeing people or objects that aren't really there, smelling odors that nobody else does, and feeling things when nothing is touching them. Another symptom is delusional thinking. Delusional thinking goes hand in hand with the person's hallucinations. Even when they are shown that the hallucinations are not real, the person cannot accept this. A person with schizophrenia may think that something is directing a secret, special message to them, such as a TV commercial, or think that someone is out to do physical harm to them. When a person with this disorder is attempting to have a normal conversation, they make up meaningless words, stop abruptly when talking, and say that their thought left their mind, and often have jumbled, disorganized speech or thought processes. Less common symptom involves movement disorders, including agitated body movements, repeating certain motions over and over again, and completely stop moving physically altogether. Other symptoms involve depression, extreme emotional distress, lower cognitive ability, lack of pleasure in everyday life, suicidal thoughts or actions, speaking very little, trouble paying attention, or problems retaining information even when information was just presented to them. When a person presents these symptoms, there are a variety of different diagnostic tools that are used to diagnose someone. When the diagnosis of schizophrenia is suspected, there is a variety of different medical and psychiatric questions that are asked and investigated. Physical exam, blood tests, psychological exams are also done. Laboratory tests, including complete blood count, is done in an attempt to rule out other conditions. The person is then tested for alcohol and drugs in their system. If these tests do not come out with any significant results, then MRI and CT scans are done with the person's brain. The psychological evaluation involves checking mental statuses of the person, observing the hallucinations, mood delusions, and thoughts. In order to be diagnosed with schizophrenia, a person must meet the criteria in the Diagnostic and Statistical Manual of Mental Disorders, which is published by the American Psychiatric Association. The criteria that is required for diagnosis of schizophrenia include having at least 2 of the following: hallucinations, disorganized speech, catatonic behavior, presence of negative symptoms for a significant amount of time, impairment when attempting to do schoolwork, staying employed, or performing daily tasks. These symptoms also must be present for at least 6 months. There are different types of subtypes of schizophrenia that a person can be diagnosed with. Paranoid is characterized by delusional and hallucinations, less functional impairment. This subtype offers the best type of hope for improvement. Catatonic is a subtype where the person doesn't interact with anyone else. They get into bizarre physical positions, engage in meaningless gestures. Disorganized schizophrenia is thought and expressions of emotions that are inappropriate. This subtype offers the least chance of returning to a normal functioning level. Undifferentiated is the largest group of schizophrenia, where symptoms come from 2 or more subtypes. Residual schizophrenia is characterized by extending periods without problems, but exacerbations of symptoms occur occasionally. The subtype, age, level functioning, and lifestyle of a person can make the decisions for the specific treatment the person undergoes. Due to the fact that the exact cause of schizophrenia is unknown, there's usually a combination of antipsychotic medications and psychosocial treatments that are used to help the person with schizophrenia get to as close to a normal level of functioning. Treatment for schizophrenia also requires a lifelong treatment after symptoms have subsided. Antipsychotic medications are most commonly prescribed to treat schizophrenia. This type of medication helps control the symptoms by affecting the brain's neurotransmitters such as dopamine and serotonin. This type of medication is available in pill and liquid form, but if a person's level of functioning is significantly decreased, the person can also receive these medications in shot form so that they don't have to take medication on a day-to-day basis. Antipsychotic medications come with the risk of countless side effects such as blurred vision, rapid heartbeat, skin rashes, tremors, persistent muscle spasm, restlessness, diabetes, and high cholesterol. Antipsychotic medications also interact dangerously with a variety of different medications. Therefore, if a person has another medical condition besides schizophrenia, they must be very cautious of what potentially could happen to them. After a person's psychosis is under control, the next step of treatment is psychosocial treatments. This type of treatment helps patients deal with the daily challenges such as communication, self-care, work, school, and forming healthy relationships. One specific subtype of therapy is cognitive behavior therapy, which is therapy that focuses on thinking and behavior. This treatment helps patients with symptoms that don't go away even after their antipsychotic medications. The therapist helps teach them how to test the reality of their thoughts and perceptions to the real world and how not to listen to the voices and hallucinations that they hear. Cognitive behavior therapy has proven to reduce the severity of symptoms and reduce the risk of relapse. The ultimate goal of these medications and treatments is to improve a person with schizophrenia's quality of life and to help them maintain a normal level of functioning. About 1% of Americans have schizophrenia. This illness affects men and women equally. There is no way that a person can prevent themselves from getting schizophrenia. However, with early diagnosis, proper treatment, symptoms can be under control without serious complications. The longer a person with schizophrenia goes without proper medications or therapy, the more likely there will be to have negative health effects on the person's life. Although schizophrenia is a lifelong mental illness, the proper diagnosis and treatment of these people lead to a normal functioning life.
1,
2, 3, 4,
5, 6,
7, 8, 9, 10.
Was it 5 minutes?